Okay, so I'm going to show you the general version of Andaman7, the general features of the personal health record and the capabilities of sharing your health data and connecting to your hospitals or labs to get your data locally, to get a copy of your data locally. I won't talk about the other features of Andaman which are related to clinical trials or other use cases. There's about a dozen use cases, but they will not be demoed here. So here I'm launching Andaman, the personal health application. Initially, normally there is only one record, which is my own record, which is on the top. But here you see that I added 4 extra records, 3 for my children and 1 for the demo called Adams-Pola. So the view is very simple here. As you can see, it can be used by patients for managing the health data of their children, their parents, their close ones. Could also be used by healthcare professionals if they wanted to, as a good quality health record, but without anything about invoicing or organizing the work, right? It's just about a list of patients and everything about them. When you create a health record, initially it appears like this in a very simplified matter, because what becomes very obvious when you start thinking about doing a personal health record, especially something for patients, is that it's very hard to present the information in a simple way. If you look at electronic health record in the hospitals, they are usually really monsters, I would say. They are very hard to use, and there's lots of screens, lots of data elements, just because a screen for a nurse is different from a screen for a surgeon, which is different from the screen for a gynecologist or any type of specialty. So all of these specialties need their own data types and screens. So it makes for a very complex application. And when you want to show all of that information to a patient, it becomes really a nightmare, because you have to show it in a very simplified matter. So if this looks simple for you, that means we did a lot of work to make it so simple, right? Like the famous French philosopher Blaise Pascal said a few hundred years ago, I'm sorry to have written such a long letter, but I didn't have the time to make it shorter. So it's exactly the same here. So what you see here is just a few fields, allergies, appointments, contacts, but there is a plus, a green plus symbol there, which shows that you can have a number of additional sections, if you want, in your health record that you add only when you need it, or when you have data coming from your hospital in those sections. So we start with the very simple ones, and we can add any new ones. The ones that are here are the ones that are by default, but for specific projects with hospitals or with pharma companies or any type of other partners or customers, we can also create specific tiles, if you want, in here that collect a number of specific data points. So this is extremely extensible, and this can be done even without changing the application. I'm going to go into Adams-Pola record now, because this one is populated for demo purposes. And I'm going to show you a few of those tiles, like the allergies one, for example, where you can see personal and allergies and intolerances. You can see also that it's quite advanced in the sense that if you get tested for an allergy and you do not have it, it's still listed here under refuted allergies. You can have family allergies also. And so as you can see, there's quite a lot of information just for allergies. Now, suppose I'm adding a personal allergy. These are some of the fields that are available, the type of allergy, when did it start, the severity of the reactions with a number of specific fields or lists. And all of these usually come from standards like FHIR and others. As you can see with the small circle with the green circle here, I can add links to other things in the health record. This is a powerful capability of Andaman, is to be able to link information in many directions. So here I can link to treatments, I can link to documents that will give me more information about the allergy. And then if you look on the bottom here, the About section, this is for health literacy, right? So this is to help train or coach or improve the knowledge of patients. So here we explain what an allergy is, what an intolerance is, also other fields that are present, like the criticality, the severity, and all of these. So these are helping texts that are available for most of the fields. Here I'm just showing the allergy one, but it's present in many of them. So this is also very interesting because patients gradually learn more about medical stuff, basically. So another easy to understand tile is the contact tile, where I can put the various care facilities, hospitals, doctors, specialists, family doctors here. And for us, this is part of the health record, meaning that if I go see several specialists, my family doctor will see them in my health record if I share that record with him. So that's a very good way for my family doctor to be well aware of who I've been in contact to and to contact them again in case of problems. That's just to show some innovative ideas which we have had, and in this case to put the contacts right inside the health record. Let's look at the documents sections. You can see here that I have a number of documents. I can have letters, I can have protocols, I can have lab results, like here you see a PDF that I have entered there. It can come directly from the lab, it can come from the hospital, or if I get it via email, I can add it myself in the list of documents. If I only have a paper version, I can still take a picture or scan it and add it and have some kind of library of all my medical documents here. Of course, I can have images like this one. That's a radio with a lamp here. And I can also have pictures that I take and add myself. So here I took a off-the-shelf gluten test, and I have the picture of the results, and that is in my health record. So it's automatically shared with my family doctor, so he knows the results of the gluten test, right? So that's really empowering the patients. Of course, those documents can be sorted by many different fields: subject matter, provider, date, care facility, and so on. That's for documents. Of course, I can enter appointments that I've had in the past. I can enter future appointments, and there I can also write notes so that when I will be in front of the doctor, I will have all the information, all the questions I have to ask him. And let me simulate the fact that I'm adding a new appointment. I can add it for today, or I can pick a date in the future. I can say it's about my cardiology problem or my dermatology problems. So that's the subject matter. The name of the doctor and the hospital the hospital I will see. And here, of course, I have these two, but I can add any number of providers that I have contact with. Something very interesting here is that the patient notes. So I can enter my personal notes, and I will see if there is a connection, of course, to the software of the providers. I will see the providers note. So you can see the two different aspects, and you can see if there is good understanding between the two. And they don't mix, of course, one with another. And then there's all kind of biometry fields that are typical of the consultations that you will find also somewhere in the health record. Some quick notes about clinical exams, and then again, possibility to link to other parts, so other exams, to link to conditions, to link to drugs, and various types of documents. You can see that I can write personal, private notes that will not be shared with whoever, with anybody, even if I share my health record. So that's for appointments and visits. Blood tests is an interesting section too, because here we combine structured and unstructured data. Unstructured data is documents, similar to the one I showed you earlier, right? So in this case, I receive a document. I can read the results, it's okay, but I cannot really use them, process them, right? Because it's in the document. But it's still useful for me or for the humans that will read it, like my doctor or nurse or something like that. If I can add myself data points. Here you have a list, a quite long list, and it's always being added, but of test results that I would be interested in following myself, because the problem here is that there are hundreds of possibilities, and a given patient is usually interested in one or two parameters to follow, right? So we have to combine a way to not to simplify the screen that you have that you see here, but also be quite complete so the patients can find the parameters they want to follow. In this case, I put cholesterol here, right? And you will see that I have a few data points for the cholesterol. Then if it's structured data, then I can graph it. I can have also normal values, maximum, minimal values, as you can see in this graph here. So that's the good thing about structured data. Again, in the About section, there's all kinds of information about this specific parameter that comes from reputed sources, of course. So if the patient wants, they can read all about that and become really expert on a very specific parameter, for example, that they want to that is about themselves, right? So that they want to follow. Of course, again, we can sort them at any types of data points. And if the lab is capable of exporting data in standard formats like FHIR with low encodifications and so on, then they can come here in your Andaman7 PHR automatically and appear in this screen. So we support a number of standards. We are able also to connect to hospitals and labs that have proprietary formats. That requires a little bit more of work, of course, but it's completely feasible. And we support standards like FHIR and Low-Ink, and probably you won't find many mobile applications that support standards like Low-Ink, because it's an 80,000 codes specification, so it's quite complex and it's difficult to do that on a mobile phone, but we did. So another section I can show is the body measurement, for example, or vitals. Here again, there are quite a number of them that are available, but we only show the ones that the patient is interested in and has added. And some of them are simple data points like the heart rate or the blood pressure, but others are calculated, like the BMI, which is a function of weight and height. So there are a number of them. Of course, we have a number of units. We have metric units and we have imperial units and other kinds of units if necessary. And I will take a simple one to demonstrate the weight, for example. You can see here that since it's structured data, we can have graph and feedback and so on. Of course, I can add a value. I will show you the history. So here you see that behind this, there's quite a number of values for my weight at various points in time. And if I click on one, you will see in the middle of the screen, source Whittings. So this specific value, I did not enter manually. It comes directly from a Whitting scale. So what I do in the morning, I go step on my scale. And when I step down, the data is transmitted to my phone, either via Bluetooth or Wi-Fi, depending on the device. And then Andaman collects it automatically. So I have my graph of weight that is automatically done without me having to enter anything. So it's completely automatic. And if that data is shared with my doctor, the doctor will also see all of that, right? So that's the beauty of having a personal health record and an intermediation platform like we have in Andaman. I'll come back to the sharing a little bit later. Logbook and notes, simple thing, but for a patient, sometimes it's very useful to write down notes day after day. So when they go to the doctor, it's not just the memory of the last few days that they have, but they have the full record of everything that is worth mentioning to the doctor and that maybe happened 2 months ago, right? And that will help with the diagnosis that the doctor is trying to have. There's a short here field with what we call the record summary, and here I just put the main elements. I did that myself, right? Until the artificial intelligence can summarize a health record in a few words. Until that happens, I can also do it as a human and write down the main important things that I have to tell a new doctor that I would visit. Finally, regarding the parts of the health record that I want to show to you today is the medication part. Here we have a list of current and past medication. I can add any new medication I want, of course. And you can see here that it can be simple or very advanced. This screen is quite simple, right? I can enter the drug and the prescriber, and that's all I enter. Or if I click on the dosing button, I can add a dosing, which shows a whole new screen with lots of information. For example, the unit. There's many kinds of ways to take a drug, as you can see here. These come from standards again, right? We didn't reinvent the wheel. These come from standards. And then I can enter how many tablets I want to take, 2 tablets. I can schedule, so I can put a start date. I will start today. And I will repeat that. Yes, I will repeat daily, weekly, monthly. It's completely flexible. Daily, every 2 days. I want to take that drug, and I want to take it at 8 in the morning. Okay. Right. If I want, I can put an end date or not. And I can enable reminders if necessary. There's even details like administration routes, so all kinds of rights for administering the drug. So all of these can be that can be entered by the patient, and hopefully in the future, when there's going to be connections to pharmacies, online pharmacy, we are ready to do that, but we're looking for partners. The pharmacy will be able to deliver that information directly to the patient inside the Andaman record, and there's going to be nothing here to enter for the patient. You can see that there's even room for patient instructions and so on. So I will cancel this. You can see that I can enter reasons for the drug also, why I'm taking this drug. There I can notify conditions and other elements. And I can also link to documents that would mention information about the condition for which I'm taking the drug, maybe the prescription of the drug, maybe some recommendation for the drug, or any kind of documents that I would have locally. Okay, once I have my medication that have been entered here or downloaded from my hospital or from my online pharmacy, I can click on this button, and here you will see that I have a clear reminder of the 3 drugs that I have to take today: 2 in the morning, 1 in the evening. I can have as needed drugs also to allow for special cases. And as soon as I click on here, cetirizine, for example, this is recorded. So there is intake information that is recorded. So Andaman now knows what patient has taken what drug at what time. And since this is part of my health record, when I share that with my hospital or with my doctor, they will be aware of that information too. So that's a real medication adherence systems that we have here. Not only local adherence for the patient, but also being able to share that with the healthcare professional means that almost in real time, you can have a medication adherence system included. So these are the main elements of the health record, just to show you why we call it a personal health record and not a personal medical record, is that we do not only store medical information, I mean information coming from a doctor or a nurse or any kind of health professional, but we can also store any kind of information that is not purely medical, but has some effect or some impact on my health, like workout and sleep, for example, active energy, flight, climb, so active activity information, sleep information, and even nutrition information. So it's really any type of nutrition would be somewhere here, nutrition information, as you can see here. So it's really very complete and pervasive information that I can enter in Andaman. Quickly, I can have an overview. So any type of information in my health record, I can click on the star and I decide that it's important for me. So this will appear in that short summary screen. The timeline view is also quite interesting because there I can see what information has been entered in my health record recently by dates. For example, so here I see that I have a blood test for my yearly checkup that arrived recently on April 14th, and it came probably from my lab. So I can be informed of when this information has been entered. And I can have filters about that, and I can have sorting also about all of this. Now, a quick note on sharing. Andaman includes a personal sharing feature that is initiated by the patient, or I should say by the individual using the health record. It could be by a health professional or the patient. Normally, the screen is empty. What I do is, so this is the record of Paula Adams, and I decide that I want to share that record. So I click here. I first see my circle of trust. So the circle of trust is a number of people that I trust in the Andaman7 community. So that would be my spouse, maybe my parents, my family doctors, or a doctor in my family, right? So I can directly select one of them, or if I want, I can search for somebody in the full Andaman community. So here I can type parts of a name or first or last name, and I will see all the people that use Andaman and that are part of the community. Of course, you can hide yourself from the community if you don't want to be visible here, but then this will limit the sharing capabilities, of course. But otherwise, you can see the people here, and the information you can see is very limited, of course. It's first and last name, city and country for privacy reasons, right? So suppose I select that person, and I decide now that for the record that I'm sharing, I can select all the information, or not all. I can select just a few fields and just share a limited number of fields with that person. This is a sharing of what I'm going to share. So if I click confirm, it will start sharing. I won't do it here for the demo, but here you can see that Marc Morel from Singapore will receive the information about Paula Adams, but only the information in the sections that I mentioned here below. Right, and when I click confirm, what will happen in the background is that all the information that fits the conditions of belonging to the sections here will be shared in the background with Marc Morel. Of course, data is encrypted. Of course, data goes through internet. There's no other way than sharing data via internet, really. But no data will be in the cloud, stored in the cloud, because as soon as it will arrive on the smartphone or the tablet of Marc Morel, the data will only be present on his smartphone and on my smartphone. There is no data left in the cloud at any point. There's only transient data, and all the data is encrypted anyway. So it's highly secure. So you have seen now the content of the health record. You have seen how to share it. On the right side here, you see that Adams Paula health record is shared with 3 persons. And you see 3 persons because the other ones have been inactivated. So of course, as a patient, I can decide to stop sharing my health data simply by clicking that button. And I can also you can also see that I am receiving information in that health record from these people. So there is a possibility for me to share one way, or for me to share one way and have the other person share with me in the second way, so two-way sharing. But it's not always appropriate. Sometimes doctors want to send data to patients and they don't want to receive data from patients for some reasons. Okay, this is the health record of Andaman. Of course, we have notifications for many events that happen when you receive new information and so on. There is configuration personal data. There is settings, everything that you can use. There is a what's new section. Our privacy policy is very important. Here you will learn that nobody has access to your data except yourself, right? So there is no catch, there is no nothing hidden. And Andaman is completely free. So some people say if it's free, then you are the product. This is not true. In the case of Andaman, if you install the app and you use it and you don't share any data with anybody, it's completely private and no information will be shared. And Andaman7, the company, does not have access to your data. So this is, why do we do this? It's for social reasons. The founder has had cancer and his son also, and they wanted to contribute back to the community by giving away a free application where patients can be empowered and use their data for themselves. And of course, there is a need for revenue for the company, and the revenue comes from hospitals that want to have projects with some patients. That's where we have revenue for financing the development of this software, and also medical research projects where the electronic questionnaires are sent to patients. And for this, the medical research players are paying a fee to us. But always the patients are invited to those services, and they always need to explicitly consent. So there is no catch. It can be completely private if you want, and only if you wish to share your data or to contribute to a project, then you can give your consent, and then the data will be shared. Last thing I want to show to you is that fourth icon on the bottom right, which is called the services area. You see here a number of sections of services. These are services offered by partners or other companies, because Andaman, we cannot do everything, and we don't want to do everything, of course. So we focus on the data of the health record, collecting it from many sources like hospitals, like labs, but also connected devices of various sorts, like glucometers, like smartwatches, like blood pressure monitors. And we support hundreds of devices, both on Apple and Android smartphones or tablets, but that's all we do. So if we want to, if you want to book an appointment with your doctor, then you come here to the book a medical appointment section, right? And there you see some of the partners. I show here partners from a number of countries, but normally if you click on the top right, you can select the country you live in, and you will only see the services for your own country. But for the demonstration purposes here, I've included a number of countries. So you see here that you can click on the ZocDoc, and then you will directly go to the ZocDoc system, or same thing with Dr. Anytime, Doctina, and others. So this is shallow integration, because when you click here as a patient, you just go to the website of these services or these companies. But with some of them, we plan to have deeper integration. So that means that there is going to be a exchange of some data. For example, for the book a medical appointment service, some things that could be done is automatically logging into the other system, giving my name and my favorite doctor, or the list of doctors I'm seeing, and then automatically or quickly select an appointment, and then the appointment information from that a booking system will be copied down back to my phone, and it will be visible if you remember in the list of consultations. here, appointments visit. So ZocDoc or Doctina could send the information back here. So it would be completely integrated. But booking an appointment is just one example. I could also order my medication online. And when I click here, I go to my favorite online pharmacy. And again, a deep integration here would help me be automatically logged into that online pharmacy. I could select the drugs, share the prescription, and I could receive from the pharmacy the list of medications that I will receive by post, and all the information about how to take that drug and the recommendations could be downloaded automatically to my Andaman application and shown in the previous sections on medications that I was showing you earlier. Same thing for teleconsultation, for video consultation, right? You can select a number of services and directly be connected to your doctor to have the consultation. And here, if we have interesting partnership with some of these teleconsultation companies, that would be very powerful for both ends of that video channel, so the doctor and the patients, to have Andaman and be able to share all the useful information. Like, for example, patients could share symptoms and a number of other conditions they have, current drugs they are taking. The doctors would see them on their side in their Andaman during the teleconsultation, the video consultation, and then they will write down the anamnesis or the diagnostic of the patient and maybe a prescription, and all of that information will be entered by the doctor in his Andaman7 version and transmitted automatically to the patient if there is a sharing agreement between those two. So really the power, the integration with partners could be very powerful for patients. Quickly, a few others. Find My DNA Profile. Here are a number of companies that provide DNA testing. Again, here it could be extremely powerful to have partnerships with some of these companies, because then, of course, with the patient consent first, there would be a way to share medical information or health information with these companies that could combine it with DNA analysis they did, and then create new insights for patients and their doctors, and the new insights could be directly shared back to the patient and inserted in the personal health record of the patients, which then in turn will be shared with the family doctor or the specialist or whoever. So combining Andaman7 with DNA providers is also very interesting. Finding a clinical trial, also interesting for connecting to companies that provide those services. That's important for patients that have very critical conditions for which there is no recommended treatment anymore. So they would be very much interested in looking for clinical trials. And then importing data from your lab or your hospital is also something that can be done. That depends on the countries, of course. Some countries are more advanced than others. The most advanced currently is the United States, where thanks to the FHIR standards that is being imposed on all the providers, there is a way for us to connect directly to some of these hospitals. So we support thousands, dozens of thousands of hospitals, labs, and private practices through partners, right? Partners like Apple. Of course, if Apple is connecting to your hospital and on your behalf, you can, all the information you collect comes back to Andaman. But we have also other providers in the US, and for other countries, we can have other providers. So that means that the globalization of Andaman is really a possibility, a real possibility. By the way, we support more than 20 languages. So that's, of course, English, Spanish, and most European languages, but also Chinese, Japanese, Arabic, Russian, and many of those languages that include right to left and top to bottom display on the screen, right? So here I was looking for the Mayo Clinic, and I'm clicking on on the Mayo Clinic, and I have some information that it's telling me what's going to happen in the background. And here, my smartphone, here I'm based in Belgium, in Europe. My iPhone is directly connecting to the Mayo Clinic in the US and presenting the login screen of the portal. So if I had a username for Mayo, if that was my clinic, I would be able to enter my username password here, signing, and then all of my health data would be copied down from the software that Mayo Clinic is using. I don't know if it's Epic, Cerner, Allscripts, or another one. There's a few dozens that are supported. Most famous ones are supported here. And so you see that in a very easy manner, I can connect to my hospital and get a copy of my health data locally. All of that health data will be nicely integrated with the information that I'm entering myself, and will also be integrated with the information that I'm collecting from other sources like connected devices and so on. Voilà, all of that is real. You can download Andaman from your App Store or your Google Play store. It runs on smartphones and tablets. It runs on Apple and Android devices. It's free for individuals. The business model is based, as I said earlier, on revenue from hospitals and medical research stakeholders. So I invite you to install it and to test it and to send us feedback on improvements, and start being in control of your health data, because when you have a serious sickness, it becomes extremely important to have all your health information with you locally on your smartphone, even if you don't have internet connection, even if you're in a foreign country. All of that is within your hands on your smartphone inside Andaman7. Well, I think I shared most of the most important features. Thank you for listening, and please use Andaman7 and give us your feedback. Thank you for your attention.